All right. So good afternoon. Welcome to the Health and Government Operations Committee. This is actually Wednesday, March 27th, and we're going to have some bill hearings. I just want to go through some very quick rules. I want to thank the committee for your hard work. You guys have worked so hard, and staff, and Madam Trooper. Thank you. You have been with us all session. We couldn't do this work without you. For those of you that are in the audience, we're going to go by really quickly, really fast. And what I want from the people testifying today, I'd like you to tell me who you are and tell me whether the bill is in identical form. If it isn't, then you can describe it. But if the bill is in identical form, you could just say that, okay? And as you notice, HGO has been voting immediately after. We have passed all our bills. We don't play games here. Like, we're very respectful of your work, and I love working with the committees in the Senate. So we are, feel pretty serious about the work that you all do and us as well. So other than that, we're going to get started. Some bills will have a couple of witnesses. And they're not sponsor only, and that's because of the nature of that particular bill. We're going to start in the way I saw you. The first one is going to be Delegate Augustine, Senate Bill 938, Maryland Department of Health Public Education Campaign on Prostate, Lung, and Breast Cancer Prevention. Good afternoon, Senator. How are you?
I'm wonderful. Thank you, Chair Pena-Melnick, Vice Chair Cullison, and members of the committee. Colleagues, I was so excited last week about this bill. That's why I was kind of confused on what I was saying. This is Senate Bill 938, which is an identical cross-file with House Bill 1293, led by Delegate Woods. It was passed in the same posture. I asked for a favorable report.
Thank you. Are there any question on this bill that is in the same posture? Seeing none, thank you so much. This concludes the bill hearing on Senate Bill 938. I did say the Senate Bill 245 will be first, but can you give me a second and let me go through the senators have hearings? Let me go through it really fast, okay? Next, we have Senator, have a great day. We have Senator Lamb, Senate Bill 991. Did I say Senator? What did I say? Okay, Senate Bill 991, Senator Lamb, Behavioral Health Language Assistance Service Pilot Program. And you get to have one person in favor, and if there's someone opposed, they'll come after you. Will you please get started?
Thank you. Good afternoon. Thank you, Chair Pena-Melnick and members of the committee for allowing me to testify in support of Senate Bill 991. Senate Bill 911 passed the Senate unanimously. There is not a House crossfile on this bill. It creates a statewide pilot program to make sure that Maryland children can access mental health care, no matter which language they speak. This bill will provide over $120,000 over 2 years to local behavioral health authorities who would establish a competitive grant process to reimburse mental health providers for translation and interpretation services to children. Federal law requires that children and adolescents in immigrant families have access to interpretation and translation for mental health services. Federal law also requires that these language services be provided at no cost to patients and families, but it is an unfunded mandate. As of 2017, there are 15 states that reimburse providers for language services via Medicaid and the Children's Health Insurance Program. Maryland is not one of them. In Maryland, children in immigrant families cannot reliably access interpretation and translation for mental health care, and some children have been refused mental health care due to language services not being available. Mental health providers have multiple barriers to providing interpretation and translation. There are very few child psychiatrists and therapists who are fluent in a language other than English. Increasing numbers of non-English speaking patients are seeking mental health care, so translators are in higher demand and have longer wait times. Also, translation and interpretation are not reimbursed by Maryland Medicaid. This means that the language service costs must be covered by providers, so providers are effectively paid at a lower rate for treating these children. who do not speak English. This discourages mental health providers from accepting non-English speaking patients. It can also lead to using family members of the child as an unofficial, so to speak, translator, resulting in a lack of privacy for the child, potentially biases of the family member, and potentially leading to inaccurate information being communicated. This bill would improve the quality and access to mental health care for non-English speaking children in Maryland and would make Maryland a national leader in providing language access services. With that, let me turn over to the one person on the panel, Ashley Woodlard. Woolard.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Ashley Woolard, and I'm the lead attorney for the Health and Benefits Equity Project at the Public Justice Center. We're here today in strong support of SB 991. This bill addresses a longstanding issue in Maryland where children in need of behavioral health care are refused by certain providers simply because the child or family has limited English proficiency, or LEP. We appreciate all of the work that this committee has done to expand access to community-based behavioral health services for children. Barriers to meeting the urgent need to access this care is something that many of us have navigated with our own children or witnessed a loved one navigate. But I want you to imagine that on top of trying to navigate and understand options to support your child's recovery, language is also a barrier. Healthcare providers must provide free interpretation and translation from qualified individuals to people with LEP, including children and their parents or legal guardians. However, we've seen significant non-compliance with this federal mandate among certain behavioral health providers. Across several years, we've received many reports from not only parents, but also other clinicians regarding practices that accept Medicaid and other federal funds, but refuse to provide interpretation and translation. And as we've seen in Maryland, when children can't access community-based behavioral health services, parents and guardians often turn to emergency rooms to meet their child's needs. And this places greater strain on our ERs and increases Maryland's ER wait times, which, as we know, are the longest in the country. Language access is an essential part of healthcare, but we recognize that our providers also need some financial support in meeting this unfunded mandate. And medical interpreters and translators may charge anywhere between $45 to $150 an hour, which can be a challenge for even the most well-intentioned providers. This bill is a stepping stone towards making our behavioral health system truly linguistically accessible to children and their families. Thank you for your time, and we urge a favorable report for SB 991.
And thank you for, respecting the time. It was perfect. Do we have any questions for the Senator? Vice Chair Collison.
Thank you, Madam Chair. Thank you, Senator, for bringing us this. It's really important. The one question I have is about the translators themselves. I mean, we're dealing with a highly private situation with the child. Do we have some sort of guardrails around confidentiality with respect to the translators in the bill, or is it just funding the translators?
Yeah.
Yes, so under federal law, so this comes from Section 1557 of the Affordable Care Act. There's actually very specific requirements around translation and interpretation, and translators and interpreters have ethics that they have to follow, which includes confidentiality and complying with HIPAA. So that's not something that we would need to embed into this bill on the state level, because it's already covered under federal law.
Yes.
So that applies to all translation services. And there aren't necessarily any differences in those who are translating in medical situations.
Yes, exactly. So that applies to anytime healthcare information is being conveyed from a translator, interpreter to another party, they have to comply with HIPAA. So there's protections around confidentiality, being impartial, and the other things, the other ethics that are required for them.
Thank you very much.
Yeah, of course.
Any other questions? Seeing none, thank you. Oh, Delegate Hill.
Thank you. And thank you, Senator. It's a great bill and certainly important, but I'm looking at the Maryland Association of County Health Officers, and they're saying in the absence of dedicated funding to support this work will be a challenge to establish, staff, and administer. Is that something you've already worked out, or, and I guess the second part of the question is, has the administration agreed to put this in the budget? So where are we with the funding and making sure that this can actually be actualized?
So this had already been cleared with the budget committees for the funding implications. So there's this has been approved by that.
Funding source for the local health departments, which is what they're asking about in the letter.
if it were passed, it would be future funding source to local health departments.
Great, thank you.
Delegate Johnson.
Thank you, Madam Chair, and thank you, Senator, for bringing us this bill. Do you know if there are any federal cost sharing for translation and for these services? I thought it was a 60-40 split. Is that, do you know if that's true?
Yeah, so there are matching funds available to Maryland through our Medicaid program if we do choose to cover interpretation and translation services. So currently there's about 15 states or so that do have embedded that in their Medicaid program. Early on when that funding was initially available, the match was higher. I believe now it's around 50-50 match for federal versus state funds.
Sure.
Was that reflected in the fiscal note? Do you know?
I don't recall if it was. But if not, you know,
It's not in the fiscal note.
Yeah.
okay. But if not, so the state can apply for, I think if we did this as a pilot, like a state plan amendment could apply for matching funds to cover this, we believe.
Well, thank you. We're trying to keep the physical notes down so we can move these bills. So thank you. I appreciate it. Thank you,
Thank
Madam
you.
Chair.
You're welcome. Great questions. Any other questions? Seeing none, thank you very much
All right,
for
thank
being
you.
with us. Is there anyone opposing this bill here today? All right, seeing none, this bill hearing, Senate Bill 991 is concluded. And I want to explain something. The reason why we're going to go really fast on some of them is because for those of you watching at home or you're new here, we have already seen the House bill, have heard the bill hearing, have asked questions, have gone to subcommittee, brought it back to committee, went to the floor, studied it and read it. So when you testify, if it's in identical form, just tell us and it'll go really fast. If it's not, then we're going to do what we just did, where we're thorough and we ask the questions, okay? Just want you to know that we're very thoughtful in our deliberation. And I believe, Senator Kramer, that you are next. And this is actually Senate Bill 600, Maryland Medical Assistance Program Dental Services Coverage and Rate Study.
Yes, ma'am.
How are
Good
you?
afternoon to you. I'm well, thank you. And to the vice chair and to all my friends here in HGO. Madam Chair, Senate Bill 600 is the cross file of Delegate Bagnall's House Bill 103. They're in the same posture and it's been a pleasure.
Well, thank you. And can I tell you what the most important part of that testimony was?
Saying good
You're
day
a
to, I
delegate
know.
here. Are there any questions? Seeing none, thank you for being
Thank
with us
you all
today. And
very
thank you for
much.
the courtesy to all the senator of coming to see us and everyone. Thank you for your patience as we call this bill. These bills, this concludes the bill hearing on Senate Bill 600. We're going to go next to Senator Kelly, Senate Bill 944, and I'm calling them the way I saw the senators come in. Non-prescription drugs and devices, provision by registered nurses, and sale of contraceptives through automatic devices. Good afternoon, Senator, that we love here.
Good afternoon, Madam Chair, Madam Vice Chair, members of my very favorite committee in the House. This is Senate Bill 944, which you will remember the identical cross-file of, which this committee did pass unanimously. It is in the same posture, however. There's two sentences to add to that, however. There's actually an amendment that's necessary that Delegate Williams has called in, so we would like to put it on the House side and on the Senate side. It's a minor amendment, but you will see in the third reader revised fiscal note that inadvertently, when we were adopting the MDH amendment related to the natural membrane condom regulations, we inadvertently put it in a section that had some $10,000 penalty. We don't want to do that. So MDH has agreed to this amendment language, which I don't have right now, but Delegate Williams has, I believe, requested. So we want to make sure that amendment is on the Senate version of the bill, and we would put the exact same amendment on the House version of the bill and get that through correctly. So that is the request.
Counsel for today, who does all these bill, and she's wonderful. She just made a note of it, Miss Erin Hopwood. Thank you for
Excellent,
letting
thank you.
us know. Are there any questions for the senator? Seeing none, thank you, Senator, for being with us. It's wonderful always to see you. You're always welcome here.
Thank
This
you for all you
concludes
do.
the bill hearing on Senate Bill 944. Next, we have Senator Jackson, Senate Bill 13, Public Health Maryland Pediatric Cancer Funding Commission.
Thank you.
Good afternoon. How are you?
I'm doing great, Madam Chair, members of the committee. This is a direct cross-file with Delegate Rosenberg. And Madam Chair, for the record, we were advised that there is a minor amendment that's going to be put on over here in HGO. And we will conform the Senate bill to that minor amendment. So
Wonderful. And we'll make
All
a
right.
note of that. And thank you
Absolutely.
for your hard work and
Thank
for
you all.
working with our members.
thank you all very much. I missed the house.
Well, we miss you. Are there any questions for the senator? Seeing none, this concludes the bill hearing on Senate Bill 13. Next, we have the wonderful Senator Kagan, Senate Bill 1068, Department of Information Technology Evaluation and Development of a 311 portal using artificial intelligence. Good afternoon, Senator. How are you?
Good afternoon, Madam Chair, Madam Vice Chair, friends on HGO. For the record, Cheryl Kagan, very proud to be the Senator for Gaithersburg and Rockville. This is in the medium level. It is not wonderful Delegate Kerr, who's not even in the room, is the cross
He has,
file.
if you don't see, by the way, if you don't see a member, they're in the Senate
Absolutely.
testifying. They actually can see the hearing, they watch it, they get these files
Yes.
that they review. We do care and they do pay attention, okay? Let's
Yes,
go ahead.
yes. I was not trying to embarrass him in any way. He is
No,
a
it's okay.
fabulous, hardworking delegate. So many of you may have heard me talk about how 3 people have died in my district when 911 has failed. And so I've been working, after 4 years of chairing a statewide commission, been working on trying to figure out how to lighten the load on our 911 centers, which are understaffed. And there was unanimous consensus that we need a statewide 311 system. The problem is that that's expensive. And so Delegate Kerr and I have been working on trying to figure this out. And this, as the Senate bill as amended, creates, uses artificial intelligence in a really safe way that doesn't threaten anyone's personal identifying information. And they use a 311 portal, asynchronous portal, as a great pilot program. So what time does the library close? Where can I do early voting? Or in light of yesterday's disaster, whether it's which shipping lanes are open, where can I take my boat, or help me with my unemployment benefits. We need access, and we've got to lighten the load on our 911 centers. Baltimore City was reported by the Sun to have up to 80% of their calls be non-emergency. 80%. Now, most counties probably have 35%, but we've got to figure out how to help people and yet keep the costs low. And so the 311 portal will help do that. I don't want to go too long, but the hope that I would ask of this committee is that you pass both the House bill and Senate bill looking the way that this bill language that we have worked out across the board is framed, if that's to your liking. And again, been working with the Department of Information Technology, and they are excited about this opportunity as a pilot. So happy to take any questions, Madam Chair.
Thank you, Senator. Are there any questions for the senator? Delegate Kaiser.
Thank you, Madam Chair.
You're welcome.
Thank you, Senator Kagan. I heard you reference that it's going to use AI in a good, safe, and all et cetera way. I'm a proponent of AI and all the good uses that it could have. We all know the challenges, but what specifically do you mean by in a good, safe way?
Sure. So, so AI is the unknown frontier to most of us, I think. And so the smart folks that do it have been looking to figure out how government can use artificial intelligence in a safe way. So the first part of this bill says, figure it out and see. And then once you figure out the parameters, the guardrails, the safe and private way of using this information. So for instance, the examples I said earlier, what time does my library close, or where can I early vote? Where can I get a vaccine? Some of that is really easy. There's no personal identifying information that's needed, but a lot of people have challenges navigating bureaucracies. And so they either don't have Wi-Fi or their Wi-Fi is down during a thunderstorm or something, they need information from their government. It's a way of providing excellent customer service, access to their government, and in an easy way. So Delegate Kaiser, that would enable them, once Do It figures out the guardrails and the parameters, we think that a statewide 311 is kind of a perfect pilot program for those reasons.
Thank you, Vice Chair Collison.
Thank you, Madam Chair.
You're
and,
welcome.
Thank you, Delegate. Hi, it's good to see you.
You too.
So I'm unclear, the posture of the two different bills. Are they different or are they now conformed? Are you asking us to conform the House bill to this bill? What, I was unclear what you're asking.
Thank you. Thank you for the opportunity to clarify. So this is a many-year effort in the works here. And what we were working on and the bill that the posture that the House bill is in is a 211, 311 statewide portal. And it would be both synchronous and asynchronous, and it sets up an oversight board. It sets up a whole lot of stuff. The money isn't there. And so we narrowed it down. We don't want to wait another year to start to provide that kind of constituent service. So having an asynchronous 311 portal is what makes sense. There are 6 counties, colleagues, that already have a 311 center right now. Montgomery, Prince George's, Baltimore City, Baltimore County, Anne Arundel, and St. Mary's. They are paying for them themselves. If we can figure out how to do this, we can provide the services to people, lower the cost for our counties. And then down the road, if this moves, if it's the wisdom of the General Assembly to move it, the vision that we had was that it would be an opt-out. We're going to provide it for all 24 jurisdictions. They wouldn't have to pay for it. These services would be available. We're not there yet. The funding isn't available yet. So using AI, artificial intelligence, and starting to set up this pilot made a lot of sense in the meantime. So the House bill, just to be super clear, the House bill is the whole 211, 311 fabulousness, but that's not flying. What will fly is the Senate bill, which is the pilot using AI. So my suggestion or request would be to amend the bill to look like the House bill, to amend the House bill to conform to the Senate bill. And then I hope this body will pass both of them out and move them on their way.
Delegate Riley, followed by Delegate Hill.
Thank you, Madam Chair.
You're welcome.
Thank you for the bill. Interesting. Since I don't quite understand the AI technology to the fullest at this point.
Yes.
So I heard a lot of the subjects that, you know, that 311 is good for, which I agree. But you said this is a pilot program using AI technology. Does that mean when someone calls that they're going to get a recording, or will it automatically transfer them to the place they need to go by using technology? I don't know. So how would that work?
Great, thank you. So a little bit that's TBD, to be determined. So we envision an asynchronous portal. It could be by text, it could be on a website, it can be phone calls, leaving voicemail. There's a lot that's going to need to be figured out by the Department of Information Technology. What's easy, what's doable. So somebody could submit a query at 3 a.m. and then get a response. Somebody comes in and and it's managed. There are some questions, like the examples I've given, that are quick and easy, and some, like help me with my unemployment benefits, that may need a person to help guide that. And but we think we can fix a lot of problems for people. And something I didn't mention, based on an earlier bill that you just heard from Senator Lamb, AI can help us with people for whom English is not their primary language. And so we can make government more accessible for all Marylanders. Thank you.
Delegate Hill.
Yeah, thank you. Thank you, Senator, for, you know, always digging in and trying to find solutions to difficult problems. And thank you for this bill. You keep saying it's a pilot. What I'm reading on the third reader from the Senate is that it directs Do It to evaluate the potential.
Yes.
And then if they think there's good potential to prioritize the creation.
Correct.
So not quite a pilot. Does that mean that if they think there's potential, then they'd have to come back to the legislature and say, now can we establish a pilot? Or do you think this is an automatic pilot, even though it doesn't say it?
It says that they would prioritize this and they are eager to do something and they've just been trying to get their head around it. We have now a new AI expert who is nationally known and respected. And before I continue, Delegate Hill, your partnership on 911 related issues has been invaluable. So thank you for your knowledge and passion on this too. I think there's a let's see how far they get. But they're excited, and this is a place that makes sense to all of us as a starting place. But as for the timetable, obviously the General Assembly will be back next January. Let's see how far they get. Let's see what they create. But this is going to be the place where they start.
Okay, and if I can have a follow-up?
Yes.
And I think it's a little bit piggybacking on Delegate Kaiser a little bit. So as they're evaluating this, the language is evaluate the potential. It doesn't say anything about limitations, risk, and which is some of the other work we're trying to do as we move forward. AI is recognizing that particularly you can give wrong information, you not know it if there's no vetting or other kinds of things going on. So do you have an objection if we amended both bills, the potential including limitations, risk, or restrictions, or you think that's a problem for your bill and you just like it to read as it does?
So the bill is in the committee's hands, and so it's the wisdom of this committee. We wanted to not be too prescriptive. They wanted some flexibility, but they were amenable to starting with 311. So if there is language that you all agree with and it makes sense, I suspect that the Senate would be happy to look at that and approve it. Sure.
Delegate Taveras.
Thank you. Thank you so much. I'm very supportive of using AI tools. And in line with Delegate Hill's questioning, I do think that we may need to include maybe some language on how are you looking into the issue of implicit biases and things like that to make sure that we're taking those kinds of issues into account in the development of what could potentially be a really awesome tool.
Yes. Thank you, Delegate Taveras, for the question. Implicit bias is one of the questions that the Department of Information Technology actually specifically listed as one of the areas that they're looking into. Again, we didn't want to be too prescriptive, but that's why they're going to look into it first. They're going to analyze it first. They're not launching something halfway that's not thorough. I think Secretary Savage and her team are thoughtful about that, how this would roll out. And if ultimately it's not prime time, it's not ready, then they're going to take more time. So there aren't, so we really want to give them as much flexibility as we can. But implicit bias is totally on their radar screen, high up on the list, for sure. Thank you.
Okay. Any other questions? Seeing
This
none?
side is quiet.
Yeah.
You guys are.
Oh, you know
These
what?
guys can move favorable right now.
Sometimes it's the opposite, okay? So take it for today.
We'll take it.
I want to thank you for being patient as you answer the questions.
Of course.
The bill will go to subcommittee for discussion, and I thank you for just being available.
Thank you.
This actually concludes the bill hearing on Senate Bill 1068. Next, we have Senator Klausmeyer, Senate Bill 751, and it is Public Health Opioid Restitution Advisory Council and Fund revisions. Remember, if your bill is in the same posture, just let us know that. Thank you. You can't, not in that jacket. You can't leave that fast.
And I just would like to say hi to all my friends here, and I feel at home here. So Senate Bill 751, and thank you, Chair Penumelik and Chair Cullison, and members of the Health and Government Operations Committee. Senate Bill 751 is cross-filed to House Bill 980, which has passed both in this committee and the House floor. The two bills were amended the same in both chambers, are in identical posture, and it was from Senator Rosenberg. And thank you, and I asked you for your favorable report from the Senate.
Are there any questions for the senator? Seeing none, Senator, you're always welcome here.
I'll see you
This
tomorrow.
is your home, and next time you leave me that jacket. Okay? I love it. So this concludes the bill hearing on Senate Bill 751. Give the chair my love, Senator. Next, we have actually Senator Benson. Nice to see you. If you will be so kind, and the bill number is Senate Bill 723, Baby Food Toxic Heavy Metals Testing and Labeling, Rudy's Law. Good afternoon, Senator Benson. How are you? Great to see you. Happy birthday.
Listen, I just celebrated my 38th birthday.
Happy birthday on behalf of HGO.
There's a 3 and an 8 my birthday. But look, along with my birthday has come a runny nose. But I did go to see my doctor, and he's been my doctor for almost 30 years, and I always have my physical before coming down here, and I went back for the follow-up, and he was looking, and he kept saying, uh-huh, uh-huh, uh-huh. Then he gets up and runs over and gives me a big hug. He said, oh, Senator Benson, you're doing wonderful. He goes down the list, and he gets to, and he said, you know what? You don't even have high blood pressure. I said, stop right there. I don't have high blood pressure. I give it.
I like it. I like it. And I pray that you get rid of that runny nose.
Good thing, good thing.
That's wonderful.
You know, as most of you all know, and I'm Joanne C. Benson, Senator 24th Legislative District. I'm here in Annapolis for several groups of people, but children, one of my top priorities. Senior citizens, those who can't speak for themselves, the working people, the disabled, the veterans. I speak for the little people. And it kind of saddens me to come here this afternoon to talk to you about the Senate Bill 723. Baby food, toxic heavy metals, testing and labeling. Good afternoon, Chairperson, wonderful Jocelyn Pinion-Melnick, Vice Chair, wonderful Bonnie Carlson, and members of this committee. I am honored to be sitting here before you today to request your favorable report on Senate Bill 723. Baby food, toxic heavy metals, testing and labeling. This pivotal legislation is designed to combat the grave issue of toxic heavy metals. Now listen to this, such as arsenic, cadmium, lead, and mercury that is found in baby food products that's sold here in Maryland. If that isn't shameful, my name is not what it is. As you may know, similar legislation is in California and has already been successful in combating this problem. And we believe that Maryland can also make a difference in implementing this bill. The bill mandates that all baby food manufacturers conduct regular testing and report the findings to the Department of Health upon request. Such results must be made available on the manufacturer's website, and the product labeling must include a QR code that leads consumers to this vital information. Additionally, the bill proposes fines for manufacturers who violate these standards to discourage the distribution of harmful products. The Clean Label Products research in 2020 revealed that a staggering 95% of the tested baby food contained heavy metals, surpassing FDA guidelines. In 2021, further investigations demonstrated that some brands contain heavy metals at levels vastly exceeding safe limits. As a result, a congressional hearing was held, underscoring the need for rigorous testing of baby food for toxic elements. I do believe that Senate Bill 723 is the answer to this urgent problem, as it will establish the necessary testing protocols and ensure transparency for consumers. As you know, infants, our baby children, are at high risk of absorbing these heavy metals, which can lead to severe health problems, such as developmental delays, neurocognitive issues, and increased risk of chronic diseases, such as cancer. The federal response to this issue has been disappointingly slow, with no current guidelines for mercury and the FDA only planning to release draft guidance within the year, and the final guidance is expected in 2025. This delay highlights the urgency for Maryland to take the decisive action now to protect our babies, to protect our toddlers and our little children. This bill is being amended to say after January the 1st, 2025, a person may not sell, distribute, or offer for sale baby food in the state that contains toxic heavy metals that exceed the limits established by the United States Food and Drug Administration. I really hope and pray, and I strongly urge you to recommend and give a favorable report with the recommended amendments to Senate Bill 723 and House Bill 97. And I thank you for your attention.
Thank you, Senator, for your hard work and for working with Delegate Taveras. We really appreciate it. Are there any questions for the senator? Delegate Taveras.
That's what I was going to ask. I just want to make sure that this bill is in the same posture as the one we just passed in the House. And I just wanted to highlight that there were two minor amendments. I don't think that this bill, it was passed as is.
We got that.
Okay, I just wanted to highlight what the amendments were. I don't know if you want
We
to
have it.
mention it now or for people to know.
Yeah, we have it. We'll discuss it in subcommittee.
Do
Okay.
you have the amendments?
Yeah, yes, we have it. Council is saying we have it.
Okay.
Okay, thank you. Okay, it is in the same posture.
It's in the same posture.
Yep, it is. And we already saw it, voted on it. And thank you for your work, Delegate Taveras. We appreciate it. Yes.
Thank you very, very much.
Any other questions for the senator? Seeing none, Senator, thank you for coming. I hope you feel better and that you get rid of the runny nose, okay?
I'm doing well.
Thank you. You take good care because we need you around, okay?
Thank you very much.
Thank you for your leadership. Have a blessed day.
I'd like to think that that's the sentiments of people, but there are some folks that would hope that I'd go home.
Well,
But,
can I tell
but
you?
Senator Joanne Benson is not going home until the Lord says so.
Well, I can tell you that Jocelyn Pena Melnick told you that she wishes that you be around for a while. I can't speak
Thank
for
you.
other people. Have a blessed day. This actually concludes the bill hearing on Senate Bill 723. Let's go on to Senator Ellis, Senate Bill 1059, Maternal Health Assessment, Referrals and Reporting, Maternal Health Act of 2024. Senator, if you could tell us if it's in the same posture. I know that Delegate White Holland worked really hard at it on this committee with you, and we so much appreciate your leadership.
I cannot out-charm my favorite senators.
Don't
Senator
even try
Benson,
it.
so I will not try it.
Don't
So
try
I will be
it.
dry and introduce myself, Senator Arthur Ellis, Madam Chair Penny Melnick,
Yeah.
and Vice Chair Carlson. It's good to be here, members of the committee. It's good to see you. And to answer your question, Madam Chair, this bill is an exact posture as House Bill 1051. And I also want to just comment, give a compliment to Delegate White Holland. She did the heavy lifting with this bill. You know, they taught me in the Air Force. As an officer, you have three choices in life. You have to choose when to lead, when you have to choose to follow, or sometimes you just get out the way. Well, with this bill, I followed your leadership, and I really appreciate you doing the heavy work, working with my staff during the interim and during the session to get this bill in the posture that it is now, which is identical to Senate Bill 1059. Therefore, I ask for your favorable report.
Thank you. Are there any questions for the senator? Seeing none, thank you so much, Senator, for coming. We appreciate it. I hope you have a great day.
Thank you.
This
Appreciate
actually,
you.
my
Thank you.
pleasure, concludes Senate Bill 1059. May we go to Senate Bill 245, please? There are no other senators waiting here, right? Per se. Okay, Senate Bill 245, please. They've been waiting for a while, so I'm gonna call them. Another senator just walked in. And this is Maryland Community Health Resources Commission Sunset Extension and Program Evaluation. Good afternoon, and everyone that is waiting, I want to tell you thank you for your patience. Senator McKay, I know you just came in. We'll call you next after this bill, okay?
Thank you.
Thank you. Good afternoon.
Good afternoon, Madam Chair. Really great to see you. Mark
Nice to see
Luckner, staff to the Community Health Resource Commission. I have two ladies with me testifying in person.
Yes.
Happy to introduce them quickly and then they'll follow my remarks. And then on the computer, we have Dimitri from the Lower Shore Clinic.
Will you be so kind and bring the virtual witness, please? Thank you.
Does that
You
sound
can
good?
get started.
Okay, great. Again, Mark Luckner from Maryland Community Health Resource Commission. Dr. Peralta will be talking after me. She's from Castle Rubin. And then Dr. Brewster from the Mother County, right? St. Mary's County Health Officer, she's gonna be talking. And then Dimitri from the Lower Shore Clinic. I'm gonna keep my remarks very, very brief because I think the best way to talk about the impact of the Community Health Resource Commission is our grantees. So, Madam Chair, thanks for the longstanding support of this committee for the Community Health Resource Commission. This commission was created in 2005 by this body. I think your council had a pretty big hand in that bill. I think I saw Marie, who also helped draft that bill, Senate Bill 775, literally 19 years ago, right? This committee reauthorized us with Delegate Hubbard, bless him, right? His bill extended the reauthorization in 2014, and I've been here since 2009. Our commission has awarded 824 grants totaling 238 million. These programs have collectively served all 24 jurisdictions, serving over 600,000 Marylanders, most of whom are folks that are impacted by multiple social determinants of health and are impacted by multiple social programs and health disparities. The impact of these grants, I think, from a numbers perspective, and then you're going to hear the human impact from Dr. Peralta, Dr. Brewster, and Dimitri, is undeniable. 75% of our grants are sustained a year after the final check is cut. I know that because the Department of Budget Management holds us accountable for that. We also are pleased that our grantees, and they'll talk about this today, use our public funding to leverage significant private investments that show local support. In fact, 45 million has been leveraged by our grantees in additional funding, the bulk of which is private. And then finally, we're most committed on helping address the persistent health disparities that we know exist in our community. And these two ladies and Dimitri will talk about that in a moment. Finally, I would just say the last couple of years here at the commission has been a time of unprecedented growth. When I came in 2009, our budget was $3 million. Now it's a lot more than that. We had 3 staff people. and now I'm recruiting for 5 new positions. And this growth is due in no small part to the vote of confidence of the members of the Maryland General Assembly the last couple of years. If you ask us in the Maryland Health Equity Resource Act, we're in between years 2 and 3 of a 7-year program. And Dr. Brewster can talk a little bit about how she's implementing that grant in St. Mary's County. And we have a fabulous health director, the Health Equity Resource Director leading that work. Also, the Blueprint Bill asks us to start the Consortium on Coordinated Community Supports, which is designed to provide a statewide framework for expanding access to behavioral services for all kids statewide. And we're thrilled to be undertaking that work. It's been a time of unprecedented growth. And I think, humbly, I think we're up to the task. And I just want to, before I conclude my remarks, thank our chair, Senator Casemeyer, who's our chair. It's really great to come to work every day and have a great chair leading our work and just so see the impact of our grants every day. So with that, Madam Chair, with your permission, I'd like to pass over to Dr. Peralta.
Thank you. Madam Chair, Vice Chair, and members of the committee. My name is Dr. Ligia Peralta, physician scientist, focused on health disparities and innovation. I'm the president of Casa Ruben Foundation, an organization innovative in reaching the community where they are. We offer high quality care to under-resourced, underserved, and underrepresented communities, most recently using mobile clinics. Thank you for the opportunity to testify in support of SB 245. I support this bill for many reasons, but I'll share two. First, the Commission has consistently supported services to the community. It promotes innovative and sustainable initiatives and unique collaborations to reduce health disparities and improve outcomes. And I'll just give you our example. During the historic pandemic, we all know the health disparities became very visible, and many clinics even closed their doors, some permanently. It was an unprecedented crisis of access to care for the most vulnerable. CHRC stepped up and helped clinics like ours to address the gaps beyond providing the life-saving COVID-19 vaccination testing and unique tracing that we could do in the community and others could not. So Casa Ruben never stopped providing essential services, primary and urgent care, including immunizations required for childhood vaccinations and linkages to specialty care. That emergency relief funds from this committee allow us to vaccinate 7,000 vulnerable children and provide 25 vaccinations of COVID for families from 57 countries. CHRC investment made the difference to make this happen. And the second reason is that this is a critical time to extend CHRC's unique capacity, institutional knowledge, and management, because this is the time when we need their help for the State Health Equity Plan, which is required for the grant funding agreement application for the Center for Medicare and Medicaid Innovation. For those reasons, the bill merits your favorable vote.
Thank you, and thank you for your service to the state of Maryland. You work really hard and we really appreciate it. Next, please.
Hello, good afternoon. Thank you so much for your time today. Mina Brewster, I'm the health officer in St. Mary's County in Southern Maryland, and appreciate all your time, Madam Chair and Vice Chair and members of the HGO Committee. On Senate Bill 245, we are very fortunate in St. Mary's County to have benefited from the support, both technical assistance and funding, that the Community Health Resources Commission has offered. Some years ago, we established an equity task force in our county, a partnership across law enforcement, public schools, and the health department in order to implement some significant collaborative initiatives across our community to advance healthcare access, as well as mental health resources for our community members. We turned to the CHRC because CHRC had a reputation for supporting innovative new projects across the state, including rural communities like ours. We turned to the CHRC for some funding. I do want to note that we had several sources of funding braided across public and private sectors, several community partners involved in all of these projects. But the CHRC funding and support is what provided the catalyst to get these projects going and established. Because of the CHRC support, we established the first 2 school-based health centers in Southern Maryland. Nearly 1,000 children are now enrolled in this program. We just celebrated our 1-year anniversary where Governor Wes Moore came and spoke, and we highlighted some of the successes of the school-based health centers and the wonderful, wonderful impact they've had in our community, including the southern portion of our county, which is a health professional shortage area. We've also established a nurse-family partnership program, which advances maternal and child healthcare outcomes for our families here in St. Mary's County. And we are the second program of that kind in the state because of the support we receive from CHRC. And lastly, we've been implementing as one of 9 Pathways grants. We've been implementing mental health walk-in crisis services for our community, as well as a variety of other services that are addressing the non-medical factors that affect an individual's opportunity to achieve their best health. The CHRC has been with us every step of the way. They've come down to the county, rolled up their sleeves, and been involved in planning discussions on how we can advance behavioral health for our students and our young people in the county. They've really provided technical assistance throughout for all of our projects with them over the course of many years now. So we're very grateful for their time and their expertise.
Thank you. And I want to thank you also personally for your work in Southern Maryland, St. Mary's, which is so needed. And over the years, we're just very grateful. Okay.
Thank you.
Let's go on to our virtual witness. And good afternoon, sir. How are you?
I'm doing well, Madam Chair. Thank you so much for having me. I'm honored to be here to support the MCHRC. I'm Dimitri Gavathis, the CEO of the Lower Shore Clinic. We're coming to you from Salisbury on the Eastern Shore of Maryland. I'm also the current president of the Community Behavioral Health Association of Maryland, a member of the Maryland Health Equity Policy Committee for the Commission on Health Equity, and a member of the Maryland Primary Care Transformation Advisory Committee. And the reason I tell you that is because I have seen the impact in all of these levels that the MCHRC has done for the state of Maryland. It's been an amazing partner to move the health system towards this new model called the AHEAD model that the Maryland is now applying for. MCHRC in particular has helped with primary care integration. They've been a huge partner for us in helping the behavioral health world integrate primary care to bring very difficult services to the clients we serve. They've also funded very innovative health initiatives like our Care App program, which we did with Tidal Health Hospital, which in 6 months showed a savings of $926,000. They are a huge partner in promoting the social determinants of health, which we are now a big partner in as a certified community behavioral health clinic, only one of 500 in the country. They've helped us ramp up evidence-based practices of assertive community treatment, helped us promote healthy food programs to people with significant and persistent mental illness who died 25 years younger than the general population. Madam, MCHRC is a great fiscal agent, a great steward of our tax dollars for the state, and a great return on investment. And I implore the committee to support the continuation of MCHRC.
And I want to thank you also personally for your work on behalf of Delegate Riley and Delegate Hutchinson. I'd like to thank you. I know Delegate Hutchinson, it's in another committee testifying, but I know if he was here, he would tell you thank you as well. Are there any questions for this panel? Seeing none, excellent testimony. Thank you so much for all the work you do. You're certainly servicing those that need it the most. And on behalf of the committee, we thank you.
Thank you.
Thank you.
My pleasure. And I believe that's it for witnesses for this bill. I have no opposition, so therefore we have Senate Bill 245. It concludes the real hearing on Senate Bill 245. Thank you very much for coming and for being patient. Next, we're going to call Senate Bill 1071, and he's right there. Senator McKay, hospitals, opioid overdose and opioid-related emergency medical conditions treatment. Senator McKay, thank you for your patience. How are you today?
I am awesome and wonderful, Madam Chair.
That I like to hear that.
Amen. Madam Chair,
Amen.
Vice Chair, members of the committee. Senate Bill 1071 is in the exact same posture of a great bill. House Bill 55. And I think you all became co-sponsors. I think it was 138-0. I will find those three and have a conversation with them. That's my goal, but ask for favorable report for Senate Bill 1071. Like,
Well, you could find those three and make it perfect this time around. Are there any questions for the senator? Seeing none, Senator, thank you for working with us, okay?
Absolutely.
You have
Thank
a
you.
blessed day. My pleasure. This actually concludes the bill hearing on Senate Bill 1071. Now I'm going to go through the bills that are, they have representatives of senators. Is there someone here for Senator Gazzoni? Will you be so kind and come up? We would like you to tell us your name, if it's in the same posture. If it's different, tell us what it is. And we thank you. And again, we have heard the original bills if it's in the same posture. And let me call first Senate Bill 974, Behavioral Health Crisis Response Services 988 Trust Fund Fees. Good afternoon, and thank you again for being patient. Go ahead.
Of course. Thank you, Madam Chair, Madam Vice Chair, and members of the committee. My name is Betsy Hickson, and I'm a staffer in Senator Gazzoni's office, and I'm here to present Senate Bill 974, which was amended the same way as the cross file of this bill, House Bill 933, which was passed by both this committee and the House. So I asked, it's in the same posture, so I asked for a favorable report on Senate Bill 974.
And this is your first time here?
Yes.
Okay, are there questions? Can you handle them all, 23 of them? Okay, I bet you can do it. I know you can. Any serious questions? Seeing none, this concludes the bill hearing on Senate Bill 974. Next, we have Senate Bill 578, Senator Gazzoni, Professional and Volunteer Firefighter Innovative Cancer Screening Technologies Program Funding. Good afternoon again.
Hi, once again, my name is Betsy Hickson, and I'm here to present Senate Bill 578, which passed both the Budget and Tax Committee and the Senate unanimously. It is in the same posture as the cross file of this bill, House Bill 1472, which this committee heard on March 20th. So once again, I ask for a favorable report of Senate Bill 578.
Are there any questions? Seeing none, thank you so much.
Thank you.
Thank you. Let him know you did great. All right, this concludes the bill hearing on Senate Bill 578. Next, is there someone here for Senator Bailey? Will you be so kind and come up? How are you? This is Senate Bill 117. It is Senator Bailey, Health Newborn Screening Program Implementation or Testing. I know this is not in the same posture.
It is not.
So will you give us your name and explain the bill, please?
Absolutely, Madam
Thank
Chair.
you.
My name is Christina Vigorito, and I am the Chief of Staff for Senator Jack Bailey. And today I'm presenting changes for Senate Bill 117. This is the crossfire of House Bill 96. I know that this committee was very invested in that bill hearing and are very aware of the issue. On a personal note, I worked on this issue 10 years ago with Delegate Tony O'Donnell and my father-in-law, Delegate Jim Hubbard. So this is a interesting position for me to be in, trying to finish some of the work that he had started. As some of us remember, good bills take years. This bill no longer adds infantile Krabbe disease to the newborn screening provisions in the code. It now requires the Maryland Department of Health to add a disease to the state's newborn screening system within 1 year and 6 months of the Federal Secretary of Health and Human Services, adding it to the RUSP, as you guys are aware of. This language removes the duplicative process of the approval by the State Advisory Council on Hereditary and Congenital Disorders. Further, given the longstanding interest in testing for Krabbe, there is now uncodified language in this legislation that requires testing within 1 year of its addition to the RUSP. The legislation was originally intended to limit the regulatory delays in implementing the life-saving screening for this rare disease. It now will not only address that one disease, but will help to address all diseases that are recommended to be added to the RUSP moving forward. And I respectfully request a favorable report.
Thank you. And you know, I love your father-in-law.
I
He
know,
was
me
so
too.
great. I want to tell you that I spoke to the department and they actually submitted amendments that expand the time because they're unable to do it within the time limit. So with that, they'll support it. And I think we'll be good with that as well.
Fabulous.
Are there any questions? Seeing none? Thank you so much.
Thank you,
Okay,
Madam
I
Chair.
appreciate it.
Absolutely.
How's your mom-in-law? And give Susan my love, okay? Thank you. This actually concludes this bill hearing. And now we're going to go to, this was Senate Bill 578 is concluded. Let's go to Senate Bill 594, Senator Hershey. Anyone here for Senator Hershey? I think he was gonna come himself, so we'll put it on hold. Okay, thank you for correcting me. I appreciate it. Senator Hershey, I spoke to him. I met with him yesterday in person. I think he's coming to the bill hearing. So let's put that on hold. Is there someone here for Senate Bill 1103? Will you be so kind and come up? And this is hospital and related institution outpatient facility fees. And we know you quite well. Thank you for working with us. Tell us your name and if
Thank
it's in the
you.
same posture or not.
Thank you. I'm Heather Forsyth. I'm the Deputy Director of the Health Education and Advocacy Unit at the Office of the Attorney General. Senate Bill 1103 was before you before as House Bill 1149. And at that hearing, you heard from the Attorney General and myself and from HSCRC and a representative of the life and health insurance carriers, Matt Celentano. We had one of those picture opportunities, right? Because everybody, unlikely partners were lined up at the table who were all in support of expanding notice for outpatient facility fees. And the bill as proposed would have expanded the notice for outpatient facility fees in all outpatient service areas, not just the one narrow area where they're required now. And it would also have required out-of-state hospitals who were operating in-state outpatient facilities to also follow those notice requirements. So we had the hearing, and you heard also from our lovely consumer from Baltimore County, Catherine Ross, who testified, you might recall as well. The MHA, the Maryland Hospital Association, testified in opposition, and at the conclusion of that hearing, Chair Pena-Melnick, you might recall, you asked delegates Lewis and Schlega to meet with us to see if we could work through our differences. We had an opportunity to do that, but before we could do much more, we met once. The Senate hearing was right afterwards, just 2 days after this hearing, and they voted very shortly after that. And when the Senate voted on this bill, they stripped out all of the expanded notice provisions. So what that was decided with conversation with stakeholders and delegates Lewis and Schlega, and I think probably with conversation with you as well, to just hold the House bill and wait until the Senate bill came over, which it did. And as expected, it stripped out that notice provision. Now, it also stripped out the expanded definition of hospital so that out-of-state facilities who are working in the state of Maryland, although they had no opposition, it also took that part out of the bill. It did include some expanded procurement authority for the HSCRC, who wants those resources in order to get the study done faster. And it did advance the effective date of the bill from October 1st to July 1st, which is helpful again for the study. So taking the Senate version of the bill as it came over, we have a couple of more consensus amendments that we added to this side. Because it was so important to us to try to do something as soon as possible with the notice requirement. The original bill asked HSCRC to convene a formal study and work group and create a report and recommendations that were due to you at the end of 2025, December 1, 2025. And so the amendment that the consensus amendment we've agreed to is that that date will be bifurcated now. There'll be a work group that will work just on the impact of an expanding notice that will work over this interim and have a report and recommendations back to you by the end of this year. And ongoing will be the deeper dive into facility fees more generally and their impact on consumers and providers and everyone else, with all of the subject matter experts and the stakeholders who need to be involved in that meeting. So while we're disappointed that the bill came back from the Senate in the version that it did, we do still very, very much want this study and this work group to commence so that we can try to get some relief for consumers as quickly as possible. So I'm here to ask you for your support and favorable report on it, on the bill as its current position.
And I have great news. The amazing Public Health Committee met today. Oh, no, which one was it?
Government operations.
Government Operations, the
Oh,
amazing
and it
Government
did, and I
Operations
forgot to
Committee.
say that, yes.
Mm,
I'm
They're all
sorry.
amazing. They
are
met,
amazing and they were wonderful.
They
and
met,
They passed.
they passed the bill
subcommittee.
with the amendments that you're proposing.
Yes.
And it has everything that you just described. The
Yes.
committee discussed it at length. You were there. They're gonna be presenting it to the whole committee probably in a few minutes. Oh, I don't know if it made it to the voting list, but at some point. So this was a great refresher, and I thank you for your patience and for working with everyone. Are there any questions? Thank you so much for all your efforts. Really
Thank you
appreciate you,
For your
okay?
support, yes, thank you.
And not just on this
Thank
bill, but on all the other bills that you lend your voice, because you're very thorough.
Thank
Thank you. You have a
Thank
great
you.
day.
And thank you very much.
This actually concludes the bill hearing on Senate Bill 1103. Next, is there someone here for Senator Feldman? You have been so patient. You can come back. Marie, did you want to testify on this? Okay, all right. So this is Senate Bill 694, Senator Feldman, Maryland Department of Health, Health Commissions and Maryland Insurance Administration study. Good afternoon. How are you?
I'm doing just fine. My name is Eli. I'm a staffer in Senator Feldman's office. It's wonderful to be testifying on a bill that is in fact, the crossfile is the chair's. Senate Bill 694 is identical to Chair Peña-Melnick's bill. It passed the Senate and the House. I don't believe there were any votes against it in both chambers, and we respectfully request a favorable report.
Thank you so much, and thank you for being here. Are there any questions? Seeing none, thank you. Next, we have Senate Bill 1009. Senator Feldman, great timing, Senator. Senator Feldman, Task Force on Responsible Use of Natural Psychedelic Substances. Good afternoon again.
Long time no see. This was passed by the Senate and by the House. It is identical to Delegate Guzzoni's bill, House Bill 548. I think I'm reading my handwriting correctly. Passed Senate, passed the House, passed committees in both chambers, and we respectfully request a favorable report.
Is this your first time here?
Yes, it is.
Okay. Are there questions?
Where do I start?
Thank you for being here. And any real questions? Seeing none, thank you for Senate Bill 1009. Tell the senator that he owes me a key lime pie. He'll know what it is. Thank you for being here. This concludes the bill hearing on Senate Bill 1009. And now we have the last bill of the day, which is Senate Bill 594. Senator Hershey, Maryland Medical Assistance Program, coverage for the treatment of obesity requires study. Good afternoon, Senator. How are you? How's your day going?
It's been long already, but I'm happy to be here for your last bill of the day. So
Well, wonderful. Great to see you. You can get started.
thank you very much, Madam Chair.
welcome.
Members of HGO Committee. For the record, Senator Steve Hershey to present Senate Bill 594, which deals with the Medicaid coverage of FDA-approved anti-obesity medications. Obviously, you will remember Delegate Lewis's testimony for this bill in this committee earlier. She had remarkable witnesses with her, one that I guess had the baby for a period of time, that talked about so many of the different reasons why we should be looking at anti-obesity medicines as a way to treat not only obesity, but many of the comorbidities that come from obesity. Unfortunately, we were a little pencil whipped by the fiscal note, and the fiscal note came in, I think, much, much higher than we had expected. Unfortunately, there were, I don't want to say it was necessarily a back of the napkin fiscal note, but it did very easily figured out that there were a certain amount of individuals that would be eligible for this through Medicaid. They took a intake of 1 to 5% of those individuals. used the $15,000 a year retail price for the prescription drug, multiplied that out, and came up with somewhere between about a half a million or $250 million. And then there was even another part of the fiscal note from MDH that came even further that said if 20% take on the drugs, we could look at over $1 billion. Unfortunately, as you all know, with fiscal notes, they are not dynamic. And none of the fiscal note talked about what would happen if we have a healthier population and what would happen if these individuals then came off of the comorbidities that dealt with obesity, such as high blood pressure, heart disease, type 2 diabetes, joint and injury. So many different things that are related to obesity, this could not take into consideration. So again, with that type of fiscal note, we were not able to obviously get that through just yet. So what we did in the Senate, and obviously I brought all of you on board with what we were doing there, was change it to a study. We asked MDH to do a more comprehensive look at not only the different types of anti-obesity treatments. And I would say, I know we're trying to refine what the cost of this study would be. It might not be necessary that we look at the bariatric surgeries and the intensive behavioral therapy that are listed there. Maybe we can just focus on the FDA approved medications that this bill is really trying to focus on. But anyways, we're asking MDH to take a better look at what this would really cost from a fiscal response position, what it would cost Medicaid. Obviously, that portion of Medicaid is funded federally as well too. But then be able to come back also and say, through looking at other states and, like I said, a more comprehensive look and saying, are there going to be savings, not just in medications, but we've heard a lot of savings back in the economy, people being able to go to work, people not being away from work as much, all different types of things that were part of the initial presentation that both Delegate Lewis provided and I provided in the Senate. So again, long explanation for it is a study bill now. But again, I think a very important study bill, and I hope, and again, as we spoke yesterday, I hope that we can get this one across the finish line, get a real study by the end of by end of this year, and then maybe come back next year with a bill that will help a number of people that are on Medicaid have access to these anti-obesity medications.
And I want to thank you for your work on it. Obviously, you put a lot of work into it, so I really appreciate it.
Sure.
I know Marie Grant is in the audience, and I spoke to her yesterday and to Mr. Moran about looking at the language, narrowing it down to bring that fiscal note down a bit. And I gave them some suggestion to work with Chris, because Chris they keep a lot of the data. And I remember that I put in a bill maybe 7 years ago that would allow for us to be able to, if you had a certain code for obesity, for them to be reimbursed. So some of that data maybe can be used, and we have a lot of studies as well. So thank you for your leadership. I know that they are going to try to help so that we can get it done as soon as possible. And as you know, I spoke to Delegate Lewis, and she's willing to do that as well. So thank you for working with our members. Really appreciate your leadership. Are there any questions for the senator? Seeing none. Oh, Delegate Bagnall and then Vice Chair Collison.
Thank you, Madam Chair, and thank you for your work on this. And I'm just looking at the text, and I know it speaks to studying the reductions in the use of medication services for comorbidities. And I know that Wegovy was just approved for heart health. Will you be able to encompass that in the study as well?
I think that's a great suggestion, and I think what's also really interesting about some of these drugs that you're hearing about is the differences that they're making, not just in what their intended purpose was. And if you remember, initially this was type 2 diabetes that it was looking at, and then they discovered that it was helping with weight loss. Now they're also discovering that it's helping with addiction as well too, and different types of things. So, you really might be getting into a real, broadly changing types of medication that can help a lot of different things. And again, I think that's the purpose of what we're trying to do, is to make sure MDH really takes a look at, not just the cost of providing it to the people that sign up for it, but where we really are going to get some other benefits to the healthcare system as far as reduction of costs and other medications. But that's a great point. Thank you.
Thank you. Vice Chair Collison.
Thank you, Madam Chair, and
You're
thank you,
welcome.
Senator, for your work on this bill. But my question is, if you have 60 seconds after this hearing closes, I've got an update on another bill, so.
I have
like to
60
get-
seconds or more if you'd like. So I don't need to run back to finance just yet. So
Yeah.
thank you and Madam Chair, thank you very much for your for meeting yesterday and your phone calls that you made. And I know with your influence, we'll get this across the finish line. So
Thank you. Thank you so much. It's always, it's good to sit down, right? And work on things. And I thank you for being willing to do that. Okay? It's reciprocal. Anyone else? Any questions? Seeing none. Thank you so much.
Thank
I
you very
really
much.
appreciate
Thank you
you.
all.
This actually concludes the bill hearing